I hope you enjoyed your break, maybe got some stretches in, grabbed a snack, or grabbed some water. Next up, we have now in my head, I say this way all the time, so maybe you'll laugh at me, but we have Overruled. Gen Z's enjoyed your break, maybe got some Gen
stretches
Z's
in, grabbed a
policy
snack.
demands. And we're going to hear from this panel more so about what they're doing to demand their needs. So please help me welcome our moderator, Emma, and then you'll take it away, Emma. It's all you.
Hello, everyone. And yes, I always laugh too, but I think it's really representative of just the passion and the power you're going to hear today within this panel. So, hello, everyone. Welcome to the panel. Overruled: Gen Z's policy demands, from lobbying in Sacramento to writing testimonials and leading online petitions to share their voice. This panel will explore what it takes to pass policy and to advocate within the legislative systems on their terms, which I think is the most important part of this description. So our speakers, we have Seika, we have Ellie, we have Sophie, and we have Kelsey. And to introduce myself, my name is Emma Lembke. I'm a sophomore at Washington University in St. Louis, here because I'm the founder and executive director of the Law Off movement, but super excited to moderate today's panel. And I, alongside all of these panelists, are incredibly excited and honored to have you listening into our conversation today. So that's exactly what this is, really a moment in our busy lives where we can use technology to interact with each other in a meaningful way, and we can share our thoughts and perspectives in the process, creating solutions. And in the context of our panel today, really a space for young people to feel empowered to pursue their own advocacy efforts with the help of technological tools and the inspiration of those already leading the way. So I'm lucky enough to have four of the most outstanding young people that I have met in a while, advocates that are paving the way for a better future for all of us, here today to talk us through their journeys and provide insight in how others can also advocate and follow in their footsteps. So who better to tell you about their own experiences than the advocates themselves? So I'm going to pass the floor to Kelsey to start us off, to explain, their personal journeys and then the advocacy work that they've done thus far. Take it away.
Yeah, so hi everybody. My name is Kelsey Wu, and I'm currently a senior in high school, and I'm also a eating disorder and mental health activist. So kind of a little bit about my journey is I developed an eating disorder at the age of 14, and I sought recovery about a year later. And through my recovery process, I was actually really opened up to the realization that eating disorders are really prevalent and just like their disorder that is really proliferating and causing so much distress in not just my community but communities around the world. And I started off, like kind of how anyone would when they realize that there's a problem in their community, they want to address it in any way that they can. And I started, through that by just trying to raise awareness, starting social media accounts about it, talking to friends about it, doing webinars and like panels and just speaking to my community about this issue. But I realized that, raising awareness can really just go so far. Yes, it can make it, it can make someone think about it for the first time in like a couple of years and realize that it is an issue, but it's not really doing much to change the situation at hand. So that's really when I realized this, and I became frustrated with like the idea that I can't really do anything, especially at this age. I was really fortunate to meet some people, especially it started really with when I started my internship at the Harvard Striped Public Incubator, and it was there when I was like connecting with all these public health professionals and people who have been in the eating disorder prevention movement for a really long time. It's when I was opened up to the idea of using policy to really address these mental health issues at hand, and trying to find actual solutions that can be applicable to hundreds of thousands and millions of people around the world. So that's how I got into policy. And through there, I was able to connect with various other organizations, such as the Eating Disorders Coalition, the um, NETA, even Fair Play for Kids, etc. And we got into various different bills. For example, I'm currently working on the Out of Kids' Hands bill, which is a bill that's prevalent in multiple states, and is also on the governor's desk in New York, that's working to ban the sale of over-the-counter diet pills and weight loss supplements. And also, I've been able to work on federal legislation as well, including the Kids Online Safety Act, which is connected to the California Kids Design Code, which really is looking at how social media can really play a part in developing these mental illnesses, such as eating disorders. And I just think that being able to use my voice in a way that can power legislation and that can actually create solutions and stuff like that has been so empowering. And it's really eye-opening to see that there are so many avenues in trying to address a problem, such as like raising awareness, etc. But I do think that legislation and like using policies to address these situations at hand is definitely one of the most powerful ones. And I'm so excited here to be here today to really debrief on that topic and to also inspire others to do the same.
Thank you so much, Kelsey. Now, Ellie, I want to hear all about your story.
Hi all, my name is Ellie Sutliff. I am a junior in high school at McClatchy High School in Sacramento. So I first started getting into politics at like a very young age. My mom used to work in the Capitol, so she used in the California State Capitol. So she used to take me to work with her a lot. So I was very immersed into politics from like a very young age. I started a lot of my advocacy with women's marches. They were actually my birthday parties from the ages of like, I don't remember how old I was in 2016, but like 2016, 2017, 2018, 2019, like those 4 years, they were on my birthday. Like that was what I wanted to do. I first got into lobbying and direct advocacy at the Capitol this past summer, working with Log Off and the Children's Advocacy Institute in San Diego with the bills about age-appropriate design and social media regulations. And then after that, I've done a lot more environmental lobbying. So I worked on the climate package with the governor's office this past summer, trying to get, I did a lot of flyer handing out. I got to meet with the governor and be a student representative on a panel with a bunch of other lobbyists from different groups like healthcare and other environmental groups like the Environmental Defense Fund. So this is kind of my first time being on a panel, but I'm so excited to be here and to continue my efforts in like lobbying and activism, especially around mental health. Mental health is definitely something I myself struggle with. I have generalized anxiety disorder, and finding ways like to cope with that while also I'm a student athlete. I play water polo. I also am in like two honors programs. So finding ways to balance my life and my activities with also like my mental health while also having social media right there and like so prevalent with just like one click of a button has definitely been something to help me manage, like to help me that I've needed to like manage. And so I'm really excited to be here furthering this advocacy work that I've been doing. So thank you.
Absolutely. And as someone who was at the Capitol with Ellie, she's absolutely outstanding, both when it comes to being intelligent and being able to navigate policy, and then also just talking with people. So you follow in your mom's footsteps. You're absolutely outstanding, and I'm super excited to have you in this conversation. Now I would love to hear from Sophie.
Hi, everyone. My name is Sophie Szew. I use she and they pronouns. And first of all, I just wanted to say, women's marches, what an incredible birthday party. I mean, even from like the age of 10, if I could have that as a birthday party instead of like the sleepover we watched Despicable Me 3 or whatever we did at that age, I mean, I would have been set. So absolutely love that. But yes, a little bit about me. So as I said, my name is Sophie Szew. I am a current first-year student at Stanford University, hoping to study American Studies, Comparative Studies in Race and Ethnicity, and potentially minor in creative writing and human rights. And where I got started in advocacy actually came from a place of struggles with my own mental health. So when I was around 10 or 11, I first started experiencing symptoms of an eating disorder, and a lot of what Kelsey spoke about with having that really open your eyes about the impact that eating disorders have on your community and communities around the world was very true for me as well. And the true turning point came for me when I was first admitted to about 13 different hospitalization programs between the ages of 15 and 16. And during one of those hospitalization programs, I experienced pretty horrid institutionalized abuse. I was sat down by my doctor who told me, Sophie, we had a talk with your insurance. They asked how you're doing. And I said, we're just going to let you die because you gained all the weight you need to gain. And we can't really do much else. That's all we can help you with. And that really opened my eyes up to the fact that eating disorder treatment is rooted in weight gain rather than actual mental recovery. I did some research and found out that less than 6% of people with eating disorders are underweight, and I was part of that 94% that never really was. And these people can take up to 11.5 years average to receive their first treatment. And I was enraged. I didn't really know how to channel that. So at first, like many young women, that came through poems and writing, kind of like long, convoluted metaphors. So people wouldn't really know what I was talking about, my own struggles. So a really good example I like to give is I wrote a poem about like a thinning wine glass that just shattered out of rage, and I wrote it in like the form of like a thinning wine glass, and that really got me thinking about how language can really have power to move people. So once I was in full recovery and went back to high school, I decided to take a gap year. So last year, I spent the year in Washington, D.C., interning at the U.S. House of Representatives. I had 3 separate internships, so one with Ted Deutsch from Florida, Raja Krishnamurthy from Illinois, and Jimmy Gomez from Los Angeles. These are all representatives that work with mental health in some capacity, from looking at international mental health on a human rights level from people who experience crises internationally and genocides, to looking at mental health in East and South LA, looking at institutions and calling them and seeing what they need and how we can help, creating fact sheets, databases. So that was a truly empowering experience for me, getting to see how laws are handled on a federal level. And I had the incredible opportunity as well of going to the White House with the MTV Youth Action Forum. And I met like some incredible advocates. We all went together. We had a conversation with the First Lady, Dr. Jill Biden, the Surgeon General, and Selena Gomez about what it means to advocate for mental health as a young person and where we need to go from here. And the big last surprise was a conversation with President Joe Biden, where I shared a little bit about my story and also thanked him for trying to address health from a systemic perspective and a systemic level. Yeah, and I do a lot of other kind of outside nonprofit mental health advocacy work as well. So I'm a youth advisory board member for Lady Gaga's Born This Way Foundation, which is also an incredible community of just kind and brave souls that want to make the world a better place. And I am also a Young Mental Health Leadership Council member for Mental Health America. And back in high school, I also started my own organization, the Youth Latinx Leadership Conference, that kind of addresses mental health and other culturally relevant issues for the Latinx community. I am personally Argentinian and Jewish, so I'm really interested in looking at mental health from an intersectional religious and cultural perspective. So yes.
I think everyone would agree. Wow, wow, wow. I one, as a woman, want to thank all of the panelists here, especially Sophie, all of your work with all of the work that you're doing in policy, and Kelsey surrounding eating disorders and topics that are really stigmatized to talk about. I think that you're doing so much work both in having those conversations and pushing change, and we're only going to be better for it. So now I would love, and I also agree with the Women's March thing. You have me thinking, Ellie, about my next birthday party. So next I would love to hear from Seika and hear all about your advocacy.
Great. Well, hi, everyone. My name is Seika Brown. I'm currently a junior at Cornell University. I started my whole journey back when I was 15, when I founded a nonprofit organization that focused on mental health policy. So for 3 years in the Washington State Legislature, I had a team that worked on 2 bills. I don't know why my camera's flipping out, but anyways, I worked on 2 bills, passing one in 2019 around student well-being, both mentally and physically. Coming into college in 2020, I kind of disbanded that nonprofit and then founded a private research initiative that looks at how mental health is defined across cultures and backgrounds. Sophie, on the same scale, I'm half Japanese, I'm half English, born in the United States. So culture is a huge thing. So I do a lot of work both internationally and nationally. So I still assist the Washington State Legislature on the implementation of 988. And then I work globally with UNICEF and United Nations on kind of mental health policy in other countries and making sure that other countries are getting the support they need. And so I do a lot of research with kind of major institutions, Johns Hopkins, the Karolinska Institute in Sweden. I won the Empower Award in 2020 with Mental Health America and a Rare Beauty Ambassador. Equally, I know mental health is extremely important. And so it's very exciting to hear that we all have this rooted passion, and I'm just very excited to continue this conversation.
Absolutely. And thank you all for sharing those stories and personal experiences. I know mine and a lot of people out there listening have similar traits, and it can be very difficult to engage in these conversations, especially in environments that we might not know everyone who's kind of listening in. So I truly thank you all for taking the time. And I want to really pivot now to talk about the future, since advocacy is all about creating policy to redesign the world, its institutions, and kind of the ways we want to operate within it in the most conducive form, specifically for mental health, physical health in this conversation. So I pose a question to each of you based off of your work in the policy space, no matter what specific nuance it might take on. If you were given that golden ticket today, the chance to have one piece of legislation passed without deliberation, without a vote, and it's very undemocratic, I understand. What would you pass, and what outcome would that legislation produce? So this time I'm going to start again with you, Seika.
Great. Yeah, this is a very exciting question. All things considered, we can just pass something. I would say something around mental health education, even basic psychology courses. When I was a sophomore in high school, when I began my work, I took a 1-semester class on basic psychology. And I think that gave a lot of information about how the brain works, right? So a lot of students across the United States have to take biology classes, they have to take health classes around physical wellness, and just also how our body works. But I think it's also important to think about how our mind works. I think having a basic level of understanding what psychology is like and how your mind works is extremely important. It also encourages young people at an early age to get involved in this type of career and work. So I think it'd be the best case scenario is to include some type of mental health education, even if it's in high school. If it's like a semester requirement to take a basic level psychology course, I think would be extremely exciting. I think young people deserve to understand the thoughts that go through their head. And I know when I took my first psychology class, it was helping me a lot, kind of working through the things I've witnessed, the things I've experienced, both within and without my family, right? Because in psychology, you learn about how your environment affects you and how it affects your thinking and how it affects your actions. And so it helps you be a better person towards yourself, and it also helps you being a better person towards others. And I think that is the most exciting thing. Also, it helps you be a good student. It teaches you the things you need to learn and all the kind of ways to study, how to reduce stress and anxiety. So I don't see it having a negative effect at all. Honestly, like odds are a student will probably take some type of psychology class in their career within education. So I think making it a requirement just to make sure that everyone's getting that knowledge, I think would be the kind of legislation I would go for. Mental health education is so underrated, and we just need more of it. So I would definitely push for something along those lines.
Wow. I did not expect for you to take that approach. I completely agree. And I think putting it under the umbrella of a psychology kind of educational approach works too, because in specific environments, if you package it, just saying a mental health course, and it's harder to pass. Again, in this undemocratic environment, it would be easier. But I took psychology my first semester, and I'm with you. I was able to understand my brain better. And I also just think it's a basic right and something everyone does deserve, to be able to understand the backing, the undercurrents to their thoughts, and then to work forward to create policy change using psychology, using kind of our own features to really amplify the benefits of living in this society. So I absolutely agree with you. And now I want to know, Sophie, what are you getting passed? What's the piece of legislation?
Yeah, so absolutely love that, Seika. I mean, word, I was an AP Psych kid through and through. And absolutely, that class did change my life. So I'm going to go with a bit of an omnibus bill approach. For those of you who don't know exactly what that means, that's kind of a bill that covers like a wide range of topics. But first off, free universal healthcare. I think that is absolutely the root of so many systemic issues within our mental health care system. It is the fact that insurance and hospitals are trying to make a profit and kind of try to get patients in and out of the door as quickly as possible, slapping band-aids on problems. Because when we tie medicine into capitalism, the result is usually a lot worse than if we were to have free healthcare. And with that, I'd kind of add I am going to get this political because we are in overruled ! But I would say with that, free universalized abortions, just free universal health care as a whole. So that would cover mental health care, physical health care, gynecological care, all of the above. And I also kind of adding on to what Seiko was talking about, basic patient education. A lot of times kind of patients come into a system, especially in mental health care, not knowing what things are going to look like. They come in very scared, and there is a big lack of education about what the system looks like, and what the end term result is going to be. A lot of misinformation, a lot of kind of pushing aside of concerns, especially among women and other marginalized groups of people, just kind of saying, okay, yeah, your symptoms are kind of irrelevant. It's all in your head. Rather than that, kind of saying, okay, these are your symptoms. These are all the possible things it could be. This is why I think it's this. Just a lot more transparency in the healthcare system. So yeah, just like a big bill, kind of completely over constructing and redoing our mental health care system and healthcare system to better fit patients' needs.
Absolutely. And I love that quote, tying in capitalism and like medical care, it never produces something that is going to truly help the population and society. So that approach, I think we all should tweet at some politicians after this and use social media to get that rolling. But now I kind of want to hear, Ellie, you being in California, having this kind of politically charged ecosystem around you at all times, what are you getting past?
When I first saw this question, my mind automatically went to Roe v. Wade and allowing for universal health care and access to feminine care and abortion and gender affirming health care. But I also I live in California and I see the effects of climate change every day. So I'm really caught between the two, like a massive legislation around climate change, like more access to renewable energy, banning fracking and offshore drilling, more protection for endangered species, all of that. But also on the other hand, the feminist inside me is like, no, we need to pass legislation right now that is more access to sex, sex education, abortion, birth control, gender affirming healthcare, all of that. And I think it's really hard to just pick one piece of legislation because there are so many things right now that are so incredibly important that need to happen. And California is already very far ahead in climate change legislation. We just had our climate package passed at the end of August, which had a lot of really important things surrounding fracking and other renewable energy and stuff. But it's so hard to just pick one because there are so many that are so incredibly important and that would protect so many people and help so many more people lead better lives and just be better human beings. So for me, I don't think I can choose just one. There's also gun control and mental health legislation, and there are just so many things that need to be done that it is just so hard to pick just one that is so important. So that's kind of my take on that question.
No, I completely understand. There's a lot to address, and after we hear from Kelsey, I would love to I'll throw out the question again, but I think social media and being in this age of technology provides an incredibly powerful tool to get all these issues on the table and to provide public pressure. But then also, again, we're here for a reason. Technology is very complex, and looking at that question of how do you create balance and how do you use these devices without allowing them to use and negatively impact you, I think is really critical to investigate in our work. But Kelsey, let's hear your take.
Wow, it really sucks to go like at the end of this question because everyone really kind of said the best policies that I completely agree with all of them. I guess from my perspective, when I first heard the question, I immediately thought to kind of the bills that I was working on to pass, especially what I talked about before with mental health legislation, specifically the Out of Kids' Hands bill, working to ban the sale of dangerous diet pills and weight loss supplements to youth. California Kids Design Code, making sure social media is more regulated, and ensuring that tech companies don't take advantage of people, and that also mental health is really considered in the digital space. But more than that, also various federal pieces of legislation that were really linked to what Sophie was saying about like free universal health care, such as the Nutrition Care Act by the EDC, which is really asking for the coverage of dietitianary services under Medicare and Medicaid, so that people who are recovering from an eating disorder, they don't have to pay for these services such as a dietitian out of their pocket, which can really detriment like families. Also, things like the SERVE Act, which we're looking into the military, and actually statistics show that those in the military are almost 2 times more likely to develop an eating disorder. And also, since their healthcare is not that great, they're not as able to get recovered as fast enough or get proper adequate treatment and stuff like that. So they're obviously like looking into my specific own bills. I'd love to pass any one of them to really, especially since I had such a big part in like advocating for them and talking with legislation and stuff like that. It would be amazing to see any one of my ideas come into fruition. But I also really agree with all the other bills that everyone is talking about, especially since coming outside of mental health. I also did several internships within the California state legislative system. And over through my internships, I got to really understand about different problems in different communities. For example, in Central America, they have not Central America, Central California, they have a really big problem with their water supply, and lots of their water and their water treatment is not regulated well. Especially since that's like the real Central Valley of California, where we grow the crops and stuff like that. And there's mistreatment of farmers and discrimination, stuff like that. So there, I would say, like with every community, there's just a specific issue at hand that if you were to take someone from that community, they would of course talk about them. So I think really, if it was come down to me and in my community, I would pass something that would really really impact me and the people around me the most. But I would also say, like, if you were to ask anyone around anyone, they would probably talk about those surroundings around them. So yeah, that's my kind of outtake on this.
Absolutely. And I think going back and going off script a little bit, I do want to ask and see if any panelists wants to engage with how you have interacted with the digital world and digital platforms in your own advocacy work, and kind of talk us through that interaction. Because again, with eating disorders, with mental health, like that can both be triggered and you can find community within these online spaces. I myself have found great mental health communities, but I have been harmed. So what has your experience been like engaging in your advocacy efforts in that technological container?
Okay, I'll just start this off really quickly because I really love this question because so when I was recovering from my eating disorder, it was actually peak pandemic time. So everyone was on social media. TikTok was booming. Social media was really like one of the main avenues in which you can interact with other people. And so I created my organization like during the peak of the pandemic, and all I had really was social media to advocate my message. And I found that through doing that, one, it was a lot easier to spread my message. What really surprised me at that time was not only was I reaching people in my school or like in the immediate surroundings for me, but I was getting offerings from like people from youth from India, youth from um, Saudi Arabia to do like collaborations, and we did those things. And I also was getting a lot of people who were wanting to join our organization just around the world. And not only that, we were also getting news coverage from different places like Japan and Finland. So I think what social media really does that's like really powerful is that it's been able to take like someone like me, just a regular 17-year-old on the coast of California in the suburbs, to be able to create a movement that can reach people from around the world, and to be able to amplify messages that maybe people, like I was meeting with a girl in the Philippines, and she told me that through seeing my message, she got inspired to like raise the movement in the Philippines, where there is no eating disorder prevention movement, where the government is really not cognizant of any mental health legislation or bills whatsoever. So I think social media is so powerful in that sense. But I also what I, oh, and another positive thing about social media, sorry, but one thing also about social media is that it's a big like knowledge bank, I would say. When I was attending one of EDC's sort of advocacy summit, one person actually said that social media was the thing that like gave her knowledge about eating disorders and allowed her to self-diagnose herself with an eating disorder. And I found like I had the same sort of experience, and where like I learned the symptoms through eating disorder survivors online, and I was able to like really understand like where my behaviors were coming from. So I think in that sense, social media is a great space, but also social media can, in consideration, it's, you have to take it with a grain of salt, because there's always negative aspects of it as well, especially since there's no regulations of who can be on there, what you can post. So yeah, that's my kind of aspect on it.
Amazing. Does anyone else have any thoughts they want to share on the question?
I mean, I can kind of look at this from a very opposite perspective. So I'm someone that didn't have social media until maybe late 2021. So I kind of took that step for myself, because I knew that eating disorders and mental illnesses tend to be very competitive and comparative. And sometimes seeing representations of that online can cause people to feel triggered and can cause behaviors to kind of arise. So I am a big advocate for kind of taking time off of social media if you feel like that is beneficial for your mental health. And I really appreciate, Kelsey, that like you looked at this from both sides, because absolutely social media can be a great place to start your own advocacy journey, or kind of amplify it a little bit, or even just like become aware of other advocacy journeys you otherwise wouldn't have. But at the same time, the grain of salt piece, I'd say take it with like a whole salt shaker. Definitely be aware that mental health can be affected by social media, and absolutely is affected by social media. And because it is unregulated, and I really love that you brought up bills to kind of regulate social media and what ends up in kids' hands. A big one is the COSA Act, the Kids Online Safety Act, which I know Look Up Live did some work with. It is 100% essential that we get regulations out there so that kids aren't seeing weight loss ads and triggering instances of self-harm, etc., on their For You pages. So I think that it's advocating about social media, and sometimes you can even advocate for these bills using social media. So it's like this really weird full circle moment that I think I've experienced a lot of. But yes, I definitely say there is no shame in abstaining from social media. I think that that takes a lot of strength and is something that is admirable and takes courage.
Yeah, I'd love to just like add on to that. So I did not have a phone until I was in 7th grade or 8th grade, like the beginning of 8th grade, but I wasn't allowed to take it to school with me. I was the only person in my class. Like pretty much. I knew no one else who didn't have a phone, who didn't have social media. I had friends who got their first phones in 5th grade and got Snapchat and Instagram almost immediately after that. So then after that, I had Musically on my iPad when I was younger, and then when COVID hit, my mom let me download. It was TikTok then onto my phone. Um, and then towards like May of 2020, my mom let me download Snapchat. From being so I haven't had the same experience as a lot of kids my age with social media, but I've realized that social media is incredibly addictive. And there, again, like Sophie said, there's no shame in abstaining from social media. For me, my relationship with social media is on and off. Sometimes it's good, or other times I end up just doom scrolling through Instagram Reels, not realizing what time it is and realizing that I have schoolwork to do. So I think that it's really important to find a balance between social media and technology, and then also your real life, because it is so much like I have like long distance friendships, friends from debate camp who live in Georgia, Florida, New York, etc. And yes, I use social media as a way to communicate with them, but it is also so incredibly important to have in-person conversations with the people around you, with your friends at school, with your family. And I think it's really important to find the balance of using it for good, and then also knowing when it is not good for your mental health, and knowing that it is causing you anxiety, it is causing depression, it is giving you an eating disorder. Like all of that, it is so incredibly important to know the balance between social media and your real life. So that's kind of my take on that question.
Absolutely. And I think all of your responses carry such weight. Like you said, there is a balance that you have to strike at a certain point, and say that social media is so complex and it can really allow people to benefit, connect, to express, to explore. But like, what do you do in those environments and ecosystems when you also can be harmed? You can find addiction, and you can really see your mental health deteriorate. And that's why I'm incredibly excited to see these conversations around policy, because then that takes off some of the pressure by allowing for mental health to be more of a conversation that is on the table, for allowing people to discuss eating disorder and recovery, and allowing like all these conversations to be in kind of the bloodstream of our cultural dialogue, to then allow individuals more autonomy to create habits that help them on social media, that I think will allow people to, amplify the benefits while mitigating its harm. So I'm super excited to hear all of y'all say that. And I think my last question, I would love to kind of get y'all's brief little responses on this, and we can answer some of the questions, but it's really simple. How does another young person who wants to engage in their own advocacy efforts get started? I get that. I get asked that all the time. I know that there's not one answer, but what advice do you have from your own experience, if it's just one piece of advice that you would give? Because I do think that young people, especially in this age, we all are incredibly like activated. We're a generation that we say passion breeds passion. We're builders, we're breakers, we're innovators, but sometimes it is so difficult to get started. So what is kind of y'all's call to action for a generation to kind of get more people mobilized in these conversations? And we will start with Sophie.
Yeah. So I think in our generation, there's a lot of pressure to kind of quote unquote create your own nonprofit or start your own organization. And let me be living, breathing proof that that is not essential to being an advocate. You can be an advocate and never have started something by yourself. Sometimes that's a more effective way to be an advocate. Everyone kind of has their own journey. So where I personally started, and where I recommend a lot of people start, is by doing what most feels most natural to you, and where your other talents and passions lie. So for me, that was writing poems. And then from there, looking at organizations that work with the things I'm passionate about and reaching out and saying, hey, how can I help? This is what I'm interested in. Do you have a space for me to speak about this? And kind of going from there. And a lot of times those resources are in your community. They take a little bit of digging, but that's the beautiful thing about living this generation where we have the internet and social media. So we could just kind of do some searching through there. I was able to find some support through my high school Spanish club, and I met some people there that were also interested about mental health in a cultural perspective. And that kind of led me to kind of do more interscholastic stuff. And I also reached out to organizations, Mental Health America and the Born This Way Foundation. I absolutely did not start them, but they do incredible things. And I was able to kind of kick off my own initiatives using support from their networks. So that's the biggest piece of advice that I'd give personally.
Wonderful. Seika, what do you have to say?
Yeah, I think I have two answers for this. One, I've said this before, but the ability to have a voice, there's nothing you have to do to go find that voice. What it takes is the recognition that your voice is with you this entire time. The moment you were born into this world, you were born with a voice, whether or not you can speak, right? You have the ability to make change. So you don't need to do anything to go find your voice. It's with you. And that just takes a second of recognition of oh, wait, I do have something to say. And I definitely agree on Sophie's point that it's not necessarily you don't need to go out and create another nonprofit or another organization. In my way that I view my work is that I'm not necessarily here to help. I'm here to listen, which is a pretty I feel like it's countercultural. But I don't want to be another person that just throws a possible solution onto a table of solutions, right? I think change happens where listening occurs. And what we need to do is be listeners. So I'll encourage 2 points. One, go out and listen to how your community is doing. Change, happens again in a very personal, individual, one-on-one, intentional conversation where you listen and the other person listens to you. So you have to be willing to listen to the opposition, even to get the chance to talk as well. So it takes a lot of practice, but I think, I just definitely agree on Sophie's point that to go out and make change is affecting your communities. It's within your family. It's within your friends. And that's the most effective intentional change that you can do, because you can speak to, as many people as you want to, but intentional change is perhaps arguably one of the greatest kinds of change you can have, because it's not just you at that point. It's a community. It's a bunch of people with a bunch of different backgrounds. So one, recognize that your voice is with you, but two, also recognize that listening and talking and listening and talking kind of go hand in hand. So yeah, again, change that happens where listening occurs. And I think that's my point to drive.
Absolutely. Kelsey?
Yeah, I love what everyone else was saying. I think coming from the perspective of someone who did create an organization, I really do want to say that if I were to look back on it, would I do the same thing? And I definitely do think to get involved in policy and to get involved in legislation, stuff like that, you definitely don't need to make an organization. When I made my organization, I wasn't setting out to create legislation and stuff like that. But I found that definitely having my own organization did help in some aspects where I could support bills in an entity of more professionality, I would say. But definitely you don't need to start there. I think really the main thing that kind of everyone was saying was the 2 words, reach out. Reach out to the solutions that are around you, or not even around you, maybe in your country or anywhere that you see. For example, I think the crux of all the legislation and stuff like that is that I was able to get involved in was through reaching out to organizations such as Harvard Striped, Fair Play for Kids, the EDC, and stuff like that. So when I would really say, don't be afraid to ask if you could assist in other organizations or other people's missions, and stuff like that, especially if you're really passionate. And also don't be intimidated by the scope of how big the organization is. When you think about at least from in my experience, I was so blessed to meet these organizations and to have those people be so generous in their opportunities. Like I think I've said this before, but like as a 17-year-old girl, like I don't like have any precognition connection to like the US Congress, but like my parents were immigrated here from China, and we have no connections whatsoever to any like senator or congress member or whatever. And yet through reaching out and getting connected with these organizations, I was able to testify in the California State Senate and the California legislative system. I was able to speak before hundreds of congressional members and share my voice. And I did this all through reaching out. There was no connections or knowing someone on top. It was all through that. And I would say like there are going to be people who will love to give you opportunities, who will personally like make a chair for you and let you sit in on tables and discussions and open doors for you that you've never known that you could be able to open. So yeah, I think like there are definitely people that will be able to help you, and I would just encourage you to reach out.
Absolutely. And Ellie, to wrap it up.
Yeah, I just kind of want to echo everything everyone said. Reaching out is the best way to get involved. I think also getting like you don't need to get involved at a state or federal level at first to get anything done. Get involved in your neighborhood, get involved in your community, get involved in your school districts. Reach out to your PTSA or your PTSO or whatever it is. Get involved in your city, like all of that. You don't need like to be involved and to be making change. You do not need to be doing it at a state or federal level. There are so many ways to make change in just your community that can also spill over. And I mean, that is for me and for everyone, I feel like the most important takeaway. You do not need to get involved very high up to be involved. I feel like I'm just repeating myself, so I'm gonna cut myself off there.
Oh, absolutely. So everything that you all said, I completely agree. And I think, and following any piece of advice that was given today will get you and set you up for a really, really successful time engaging with your community and listening to their needs. So please listen in. And I think the last question we have time for is just, how can people engage with y'all's work and your advocacy? Literally just a sentence each. Explain how we can continue to track what you're doing and then help in any way.
I can jump in. Basically, I have a website at seikabrown.com. A lot of what I do is I do a lot of interviews, and so it's very exciting. I'm making a report, and it's a global report around mental health and how people talk about mental health, how you personally define mental health, and what influences your mental health. Because we all come from our respective backgrounds and the areas in which our lives kind of influence where we come from. So if you're interested, I'm always open to talking with more people. But I think I will also push for the fact that, again, a way to help, I think, all of our movements is to have these conversations with the people in your life. I think that is probably the best way to do it. Continue this conversation, talk to your local legislators, talk to your local representatives, talk to your family and your friends. That's a way how you can help the movement in general, not just within the initiatives that we have created, but the movement. So I would go for that. Listen, be the person that can make that conversation happen in your area, because that is what influences these movements a lot more than just the organizations and the initiatives itself.
I completely agree. And I want to thank everyone again for listening in and for engaging with these amazing panelists and all of their work. We're a little over, but thank you again for taking the time. And this was Overruled, Gen Z's Policy Demands. And we're so happy and thankful that you engaged.
Thank you, everyone, for being here. Truly, I feel like the world is a better place because we have you all fighting and demanding the things that we need. So thank you so much for just taking the time and actually acting on the causes that you are wanting to be a part of and the things that you're wanting to fix. I truly feel so much better to live in this world because I know you. So thank you so much to all of you. We're going to get started on the next panel. So thank you so much for being here, everyone. And we're so grateful. Have a good one.